Complete Care West Yorkshire has procedures in place to protect service users and care workers to limit the spread of infection. Safe work practices are there for when we are in close proximity to a service user. The PPE required for this task are apron, face mask, eye protection, gloves and hand sanitizer. The correct procedure for donning of PPE. Sanitize both hands up to the elbow. Put on the plastic apron, tying it securely at the back. Secure the face mask, making sure it covers the mouth, nose and chin. Put on the eye protection if there is a risk of splashing. Put the gloves on last, ensuring the right fit. Doffing of PPE. Remove the gloves first by peeling back the cuff of one and then folding it inside the opposite one so the outside surface is now inside. Sanitize hands using hand gel. Unfasten or break apron ties at the neck and let the apron fold down on itself. Hand sanitize. Break the ties at the waist and fold the apron in on itself without touching the outside and discard. Sanitize. Use both hands to remove eye protection using the straps to pull away from the face and discard. Close the eyes until the eye protection is clear. Sanitize. Stretch both the elastic ear loops wide to remove the face mask, leaning forward slightly and closing the eyes. Sanitize. Ensure safe disposal of all PPE equipment.